Assalamu alaikum. You're watching Healthwise and I'm Dr. Tahira Shahid. We hail from a religion that lays so much of emphasis and stress on the rinsing of the mouth after every 5 times a day during the wuzu. Also, it lays a lot of stress on the fact that we should use miswak for cleaning teeth and making sure that nothing is left between our teeth. But unfortunately, culturally, we don't follow any of this, and we boast and say that the lion doesn't need to wash the mouth. That is why we thought we would invite onto our studio today two very nice looking guests who are young doctors, Dr. Hannah as well as Dr. Madiha, who are both dentists and who are going to talk a lot about oral hygiene. Dr. Madiha and Dr. Hannah, thank you so much for joining us today.
Thank you for
inviting us. You both are general dentists, you both are dentists, and you are going to talk about the teeth today. So first things first, let's talk about oral hygiene right in the beginning, because that's something that we really need to pay attention to, and especially nowadays, during Ramzan, even though in our religion it was specified that even while going into a congregation or a mosque, one should not have taken any sort of onion so that they don't smell bad. But we don't, take that seriously and we just go around. So what would you have to say about that?
I just want to add up to it that cleanliness is half of the faith. So we have to be clean, not only our mouths but whole of the body. Okay, so, and our mouths are a gateway to our human body. So if mouth will not be clean, how can we expect that the whole of the human body will be clean and functioning properly? So we have to take care properly in a nice way, like brushing twice a day. And miswak is also good because it's sunnah of our Prophet Hazrat Muhammad Mustafa sallallahu alaihi wasallam. So I will emphasize on the fact that we have to clean our mouths really nicely in the sahri and after iftar, so that we should smell nice and our gums and teeth should be healthy.
And what about you? What would you say about brushing and the technique and the importance of flossing, actually cleaning the spaces between the teeth so that nothing is left behind that rots in there?
Assalamu alaikum. Thank you very much for having me over. And so about cleanliness, as Dr. Madiha already mentioned, that it is half of our faith. So, we really need to emphasize on our keeping our oral cavity clean, just like we need to clean our area, our surroundings, ourselves. So flossing, I would say, is a very major part of dentistry, especially part of, I would say, cleaning our teeth. Brush like we do twice a day, which is recommended. The toothbrush that we use, it is recommended twice a day after every meal that we take.
And the bristles should be soft or should they be hard?
So a lot of people think that you need to use a hard toothbrush, but that is not that is something that should not be done. It has to be a soft toothbrush because it's going to injure your gum line as well as your teeth. So you need to use a soft bristle, and flossing should be done after meals as well. It is very important because the leftover food in our oral cavity that cannot be removed with a brush, a floss can actually help that way, that the food that is stuck in between our teeth is actually flossed out. So it really helps if you do it in the proper way, because toothbrushing might not completely remove the leftovers.
So what is the right direction to use a toothbrush? Because we've seen, like in cartoons and what they usually show, it's sideways, but actually it's supposed to be from top to bottom or bottom to top.
It is supposed
upwards,
to be,
right?
Yes, it is supposed to be from top to bottom for the upper teeth. Reason being that we do not want the gum to recede. So you need to, for your upper teeth, upper jaw, you need to go from top to bottom, and for your lower teeth, you need to go from the margin of your teeth from the bottom to the top.
Upwards.
Because you do not want the gums to recede further.
So flossing is this thread that we use. But what about toothpicks? A lot of people use toothpicks. How bad are they?
No, toothpicks, they always injure our gum line. So we should not be using it. The thing is that toothbrushing, it cleans only 60% of our tooth surfaces. So the remaining surfaces, like the teeth in between the teeth, which are like between the two teeth, it can only be cleaned properly with a floss. And floss is, according to the international guidelines, it's recommended that we have to floss once a day before toothbrushing, especially at night time. So it's just 18" of a floss that we can use. It's about the length of our forearm, and then we twist it around our fingers and we gently enter it inside between the two teeth, and then make a C shape and do it like
so the
scrape
aim
it
is
outwards.
to remove any remaining debris or particles that might be stuck inside and cause decay in your tooth as well as everything else. How important are mouth mouth washes or mouth rinses, and what should they be containing?
Yeah.
And when we talk about toothpaste, how good is a fluoride toothpaste and how important is fluoride
yes,
for
I
us?
always put a lot of emphasis on fluoride toothpaste and fluoride mouthwashes. Fluoride is a main content, it's a mineral. It strengthens, not only strengthens our tooth structure, but it also prevents decay, it also prevents sensitivity. Fluoride is the main thing. Whenever you go to the supermarket and are buying any mouthwash or especially a toothpaste, you should see for that content of a fluoride toothpaste, which should be 1350 to 1500 ppm, which is parts per million of fluoride in a toothpaste. So fluoride is generally
and it's
the
okay
main
for children
thing.
as well?
Yes, it's okay for children as long as they're not swallowing it. We have to reinforce, we have to advise kids that you are not going to swallow the toothpaste and you have to spit out the excess toothpaste which is present in your mouth outside, especially under the age of 10 years. After 10 years, obviously they know by themselves that they have to spit out all of the excess in their mouths.
So when we talk about gum disease and a lot of bleeding gums and a lot of, painful gum disease, and, people have all sorts of bad odor from the mouth as well as their gums are bleeding and they're hurting. What would you say about gum disease? How do they go about that?
So these two things, the bleeding gums as you mentioned and the bad breath, these are major complaints apart from a toothache that a patient would present with. And so with bleeding gums, there could be a lot of factors. It could be certain diseases due to which we can have bleeding gums, like diabetes, or maybe with the vitamin C deficiencies, we have vitamin K deficiency, vitamin B12. So because of our poor diet, we are not able to fulfill all these requirements. And then because of this, what happens is if you're low on vitamin C, you end up with a gum disease called scurvy. Now, with the slightest of touch, your gums are going to bleed if you're going to be low on vitamin C. Then vitamin K is very important. It's it's important for clotting, so it can lead to failure of to clot, and hence you need to maintain these vitamins in your body. Apart from that, gingivitis is the major cause, which is inflammation of the gums. So what happens is that plaque, what we call a sticky deposit that sticks on your tooth, and it actually lets the bacteria proliferate. And once it does, all the bacteria, the healthy bacteria actually from your mouth, tend to stick to that plaque and proliferate there. That's a harboring place for these bacteria, and they end up producing toxins. So one, they give us gingivitis, the inflammation of our gums. Second, the toxins that are released give bad breath. And there are other reasons as well.
So when we talk about gingivitis or toothache, usually we are prescribed a Brufen or an NSAID along with some kind of antibiotic. So is that enough, or do we need to actually keep going to a dental hygienist regularly and getting ourselves cleaned with those plaques? Because people avoid that, they start getting sensitive teeth right after that. So what do you have to say about that?
We have to visit our dentist every 6 months. It's according to the guidelines. And actually what we do, that as Dr. Hannah mentioned, that plaque keeps on depositing on the teeth, and if we don't remove plaque within 24 to 48 hours, it hardens into a very stone-like substance called calculus. It is this calculus that is very hard to be removed by toothbrushing alone. So you have to, it is when you have to visit a dentist for a professional cleaning of your teeth, which is called ultrasonic cleaning, underneath the gums as well as above and below, both gums, so that your mouth should be cleaned and free of all those deposits, and gums, they should come back to their normal healthy state, because gums, they normally irritate by a plaque. Plaque continuously, the bacteria in them and bugs in them, they are continuously irritating the gums. That's why gums, they swell up, and this is when we call it gingivitis, which is called inflammation of the gums. Gums become red and swollen, they start to bleed. Also, as Dr. Hannah mentioned, that there are many other deficiencies. So we have to keep a check on a good balance in our diet as well as lifestyle, like proper multivitamins, proper food, everything, exercising, everything adds up to all this, because it's a circle. We have to follow that balance in order to prevent all kind of diseases in our mouth.
So how important is the clove? It's said that clove has a good, good medicinal properties, and you can always keep a clove in there or put a clove oil or something, and it's a remedy against the inflammation and the bacteria. How good is that, or is that just a,
So since ever, I think we've been practicing, we've actually had herbal medication and the other chemicals side by side going together. So, I would say herbal medicines have a lot of effect on your body, especially if used correctly and if taken correctly. So yes, it can have a good effect, because nothing better than a herbal medicine. But apart from that, and it cannot solve all your issues. So again, you would need to take it side by side. You would need to go to a dentist still, and you can use this as an emergency measure, but eventually you will need to go and visit your dentist.
When we talk about dental caries and cavities, and then it's linked to a lot of sweet ingestion, a lot of children taking all sorts of candies and chocolates and colas.
Yeah.
So what is the role of this phosphoric acid and these sugars in spoiling our teeth, and how do we prevent that?
The thing is that whenever we eat any kind of food, especially sugary food, what happens that acids they produce in our mouth. So our teeth, they are on a continuous attack under that acid. So we have to, that's why it is recommended to clean our teeth twice a day with a fluoride toothpaste. These acids, what they do that if they are not like, if we keep on eating sugary stuff especially, and fizzy drinks which are very high in acidic contents as well as sugars, so these sugars and bacteria, they both react with each other, and they attack our tooth structure, and holes or cavities they form in our tooth structure. It is when we get caries, which we call caries in our medical terms, which is cavity, and you have to visit your dentist, and then the sensitivity issue starts. Why sensitivity issues start? Because the enamel, which is the outermost layer, it is the most strongest layer of our tooth structure, and it is uncovering dentine, which is the second layer. Dentine is very sensitive. When enamel is gone, dentine is exposed, and when dentine is exposed, it is when you are getting sensitivity issues, and you are getting caries and all sort of pain and everything. So a stitch in time saves nine. So it's better that you should brush your teeth properly, take care, visit your dentist regularly every 6 months, so that it shouldn't come to that stage when you go to your dentist and the dentist says now your nerves are involved and now you have to pay for this
So what do
much.
we do about this staining? For example, teeth are stained in smokers, in tobacco users and all of this, and then they're advised all sort of these bleaching creams or bleaching trays and all of that. So how effective is that? Should they be going for that? Should they be going for these cosmetic procedures where they're bleaching their teeth and to the extent that they're obsessed with it?
So yes, it totally depends on your obsession as well. Number one, aesthetically, if you would look at a person who smokes, he will definitely have stained teeth. Or somebody who drinks a lot of caffeine or tea or green tea, all these things, they lead to a lot of staining, and most of our population does all of these things. So firstly, we would, if a patient walks in, we would advise them to make the smoking less frequent. Also, so tea and coffee is something that it becomes your habit and you cannot leave it. So what you do is you ask them to go for scaling polishing at first, if there is less staining. But if you see that the staining is severe, you do need to go for bleaching, and we do have bleaching agents. It's a process that we do in our
clinic. We shouldn't be repeating it too frequently, right?
It should not be repeated too frequently. You can do it at a span of 6 months, not before that, because it does irritate your teeth and it does produce a lot of sensitivity. So I would advise that one should do it not more than once a year maybe, or in severe cases maybe twice in 1 year. And
so when we come up to and talk about alignment and dentition, a lot of children, they use pacifiers, and people tell them don't use the pacifier, it's going to spoil the way your teeth are going to erupt. And then with the teeth coming in, there's overcrowding, the teeth are not placed properly, and then all the kids almost nowadays are wearing those braces and doing all this. What do you say about that?
Yeah, we have to be careful about it, because when the kids are small, we shouldn't give them pacifiers. But to do that, if a kid is too much on a pacifier, or they have any thumb sucking habit or pencil chewing habit, the palate, which is the upper jaw, it becomes narrow, and when it becomes narrow, the teeth erupt in different directions, and it can lead to crowding. It can lead to various dental issues, like they don't meet up properly. When the permanent dentition comes, upper and lower jaw, they don't meet up in a normal way that they should be. So there are some habits we have to discourage them in very young age, and that is why that we have to discourage kids to use any bottle feeding or a pacifier after 1 year of age. 6 months to 1 year is the age in which we have to keep on discouraging them and then wean them off into a cup, sippy cup. Or breastfeeding is also very good for kids, but sippy cup is also good, and don't give them too much of water.
What about this obsession with wearing braces? Almost everybody who doesn't even seem to be needing them is wearing them nowadays. What would you say about that?
So I would say it's totally patient dependent thing. Some people would want that Hollywood smile, as I would say. So if you need to go into, you know, the aesthetic part, then yes, a lot of people are obsessed with having nicely aligned teeth. You know, nothing better than a good smile, especially women are more concerned about this. So yes, it is a patient preference, and then definitely, other than that,
so
if
you
have
age to go about braces, and then how do you take care of your braces? Because, you know, I've seen a lot of people having food, you know, particles right there stuck in their braces.
So what we do is that with ortho patients, one, their visits are scheduled every month. So, you know, the doctor, the dentist, they know how to monitor the cleaning and everything. So they need to do scaling regularly in order to avoid any sorts of plaque deposition or calculus that hardens and sticks to the teeth. And then at home, you need to keep proper brushing routine. So, you know, you do not experience this. Swishing water off and on is also a very good thing. You rinse your mouth. So any debris that is left can be, you know, rinsed out.
How good is this oil pulling? It's been very much in the news lately that oil pulling, you know, helps you with the oral hygiene and all that. Is that true?
Oil pulling, I would say, I would still go with the, you know, the regular, yes, the old-fashioned ways. So yes, I think nothing better than, I think, rinsing your mouth often, even if brushing twice a day is recommended
so
anyway.
After every meal, you basically floss and make sure that nothing is stuck in there, right?
Yes,
and
because that basically, whatever gets stuck deposits on your teeth. And once it does, the bacteria in your mouth, they stick to it and it becomes food for them, and then it proliferates, yes, and that's when all the gum diseases, all the tooth decay happens. So definitely I would say you need to brush twice a day after your meals, because whatever is left needs to come out.
All right. So when we talk about, you know, we use terms like veneers and crowns and root canal and, you know, chipped teeth and teeth breaking off, and then people who are having an exposed nerve and etc. etc.
Yes.
So could you just shed light on that, as how important is a root canal, and, you know, you shouldn't be delaying it, or you should be getting it from the right place, because a lot of people go to quacks, and what happens as a result is, if there's anything wrong that's done with over here, it could lead to like even endocarditis for that matter, right? It could have disastrous effects on your body. So what would you say about that?
I would say, you know, coming to your first question, nip the evil in the bud is the thing that, as we have mentioned, that we have to brush twice a day and visit the dentist regularly. It is very important. Twice a day brushing, once a day flossing, visit dentist, and then so that we can see and we can spot on any changes or any pathology in the mouth, and we can treat it immediately here, there and then, isn't it? If we delay it, if you delay it, like if you have sensitivity, you have pain and you keep on delaying going to the dentist, then what happens that, you know, caries, bacteria, they progress and they spread inside the tooth structure, and they spread to the nerves. They involve the nerves. Nerve is the inner core of our tooth, which is in the center. Once the nerve is involved, there is no way back. You have to undergo root canal treatment. We have to clean that canal and remove all that infection and bacteria from within the canal along with the nerve and make it dead, and then we have to prepare it further for a crown and to strengthen it further. So why not like visit your dentist regularly, keep your mouth clean, and you know, taking care.
I think the only reason they don't visit a dentist is because your guys are highly expensive.
Yeah,
is there anything you're doing to, you know, bring down, make it more affordable for the common man?
The thing is that the equipment that we use, the materials that we use, they're all imported. They are very expensive, and the techniques that we are using, it's all hand technique that we have been trained. We are specially trained for it. So all these things add up to these expenses. They add up to this thing that the dental treatment is in general everywhere in the world.
So
is very
people used to have those, you know, gold before. So now what are they using instead of gold? Because it used to be a matter of pride having a golden tooth in there, though it looked extremely ugly, but I don't know why.
Yeah.
So now what we do is we have crowns, we have porcelain, we have porcelain infused crowns, we have PFMs, as we call them, metal infused with porcelain. So all these things are very good aesthetically. When a patient has crowns or bridges in their mouth, and you're not able to tell, it's become that good now, because aesthetically, day by day, we've worked on it and we've tried to make it better and make it look natural. Even all the filling materials now that we use, they are very friendly with the oral cavity, number one, and aesthetically they look very good. You can barely tell that, you know, a person has had fillings or they've had crowning done, because that gold concept has pretty much gone out
so
now.
in the past, we used to see a lot of people using dentures, and there were so many infections associated with dentures, and now there's this implantology where they're using implants. So what do you have to say about implants? How revolutionary has it been, and how does it help you and everything
It's
else?
the latest technology. Implant, we recommend all the healthy patients implant because it's lifelong, and it has it's just a surgical procedure, and we have to do a proper assessment of a patient, that are they medically fit, are they like fit for having an implant. It's a titanium screw which we embed into the jawbone.
So we have a lot of metal in there. So before we leave, one short message, a one-liner message from you, Dr. Hannah, as well as Dr. Madiha, or to our viewers about oral hygiene. So we start with you.
So my message would be that you, in order to stay healthy, you need to keep your oral cavity clean, because whatever you ingest has to go through your oral cavity first. So visiting your dentist once a year is a must. Keep your toothbrushing routine very regular and proper, your techniques very proper, use your toothbrushes.
All right, thank you so much.
So there are two things that I would like to say. The smile is the greatest asset, isn't it? So we have to take care of our smile. It makes sense, isn't it? And second is that oral cavity is the gateway to the human body. So if you want to be healthy, remain healthy, you have to take care of your oral cavity nicely.
Thank you so much, Dr. Madiha and Dr. Hannah. And as you heard it, not just the $1 Million Smile, the gateway to your health and your body. Thank you so much for watching. See you tomorrow, inshallah. Allah Hafiz.